in the UK burial service sector. And as we heard from the other speakers, he's been there advocating on behalf of all of us about the needs and aspirations and the requirements of our faith in terms of ensuring all the policies reflect all of that. So our next speaker, Mohamed.
Assalamu alaikum. Important people before me have been extremely important and given me an in-depth explanation of the new system. So, just to emphasize that the National Burial Council has played a central role in ensuring that some of the changes you've seen, it is faith sensitive, has been because we've been working tirelessly to ensure that faith requirements are always the center. Even just now, what Kathy and James said about the second postmortem, that was one of the first guidance we wanted to make sure that the chief coroner did. This is why it's important. And I know that each and every one of you would like James and Kathy to be your coroner. And I'm sorry, it's not going to work because there are really exceptional. And this is what it shows, that if people, that definition is what we've been asking. So one of the asks, just not because Alan is here, that's what I'm not asking, but I've asked him several times, is how long does a medical examiner have from the time he receives the cause of death or an offer of cause of death to turn around to make sure that it's issued an MCCD, custom register. It only says as quickly as possible, that's all it says. So we need a definition. But even they can't define it until we have evidence to say it's reasonable within 1 hour or 2 hours. That needs to be clarified in order to ensure that the faith committees, our communities, or whoever requires strict burials, they have the assurance that once that has been done, that's how long it will take. So at least they have a semblance of what needs to be done. The second, the coroner is not even given permission to do so. So what we have started to do is even now train for FLOs as well, to be sensitive about for any family which requires an early burial. So that's as well, that's what we are also trying to do, to make sure that every person who is part of this particular chain is fully aware of what every faith requirement is. That is extremely important for us to do so. We have been telling all of you, I think Alan has been there for 6 conferences, that the medical examiner is going to come in. And most of them, nobody said anything. Now when it's already been made mandatory on the 9th of September, everybody was saying, what's happening? Why is this happening? We've been warning you all along that this is going to happen and it may cause deaths. And similarly, we've been saying that the funeral industry will be regulated in some form or the other, whether it's self-regulation or whether the government will want to make sure on imposed regulations. Very good. But have they ever funded it? They don't fund it. So how do you expect community organizations who are supporting bereaved families? They also need to be part of that chain. They need to be adequately funded so they make sure that they are able to support families as well. It's not from yourself, but this is something which we are trying with the government to ensure that that element of it is also part and parcel of it. National Burial Council, that is important for us. So please, I do encourage you that if you're not members as well at the moment, please become members. It is important. It's not a lot of money, but it is important that we capture all your views so that when we submit to the government or any consultations, that's something that we are able to capture everybody's views. What is happening in our culture at the moment? There are certain areas we still haven't tackled, and we still need to tackle. For example, stillbirth and neonatal deaths. The number of stillbirth and neonatal deaths, it's so alarming within our community. In certain cases, it's as high as 5 times more than any other community. We need to do more work on it. And I know that the government has done so much on it at the moment. And that has been one of my asks for the NHS, is to look at this particular hospitality. and to see how can we ensure that we are able to see if we can get any sort of remedy to reduce that particular number. It includes maternity care, definitely. It includes inequalities of health. It includes not brush down the carpet. We need to make sure that we are looking at it from a perspective of how can we resolve this issue, and it is an issue. Until we recognize that it is an issue, how can we even try to resolve that issue? So please let us make sure that we do all this work because it is for our own communities, and it is something we should always be able to address. We cannot just brush it under the carpet. You just can't do that. That is messages, but it is a message for each and every one of us that death can come to us at any stage. But Allah subhanahu wa ta'ala wants to remind us that just don't think because you're young that something cheap. Let us be mindful of that as well, and let us make sure that we are always prepared for final destination. At the National Burial Council will continue to ensure that in the process, when the entire death reforms and whatever is required, they will always be there to ensure that our community voice is always heard. Our requirements are always taken into account. We may not get everything we want, but we have to keep on firm, because if we don't, then we will be ignored. This, for the first time I can say, is a lot of work to be done as well, and the government is listening, the coroners are listening, the medical examiner is listening, everybody is listening to us now, because they know, they appreciate we debate. One area where we are still not really adhering to, and this is a plea for every one of you, specifically funeral directors and those in the community. Whenever a death occurs, please nominate one person. Please do not assembly as maybe if you increase the level of scanning, maybe there's no need for that much of an increase. That is maybe one. But we also know that there is even a more acute issue with pediatric performance. That is a major problem for us. And for the first time, the government has actually placed the responsibility of pathology for the first and then the shape. Every now and then there used to be either the Department of Health, or it used to be Home Office, or it used to be that. Now for the first time. And it was always all of us for trying to make this day so far as successful as it is. Without all of your efforts and all your prayers, this would not be possible today by all. So I really do thank each and every one of you. Please do make sure that whatever time you have left, please make sure we can interact with all our guests over here who have been extremely kind to give their day on a Saturday so that they can interact with the community, for which we are really thankful. I'm sorry I don't have an open check that's been given to you, but we really do appreciate from each and every one of you. And you imagine that even for the first time for the Minister of Justice, we've had here Terence coming in to make sure that our portion of his particular is ends to share with the rest of the community. I'd like to apologize and say on behalf of the Chief Coroner for being vacant because she already had a previous commitment before she was appointed as the new Chief Coroner. But she will be there for the next session whenever we have that. But the new Chief Coroner also is committed to ensure that the bereaved family will always be the center of it. And they will do everything within their powers to make sure that each and every colonial district has the same service as at this moment provided by James and Cassidy. You are the benchmark. And this is something, and what you said profoundly today is that if there is a will, it can be done. Okay. Thank you very much for this, my love.
Thank you very much.